here today by Pam Rinaldi. She is our East Windsor Clinic Director. Welcome, Pam.
Thank you. Hi, nice to be here.
Yes. So in today's episode, we're just going to be going over just some background and, what brought you to Trinity, things like that.
Sure.
So can you tell us a little bit about your background and what inspired you to become a physical therapist?
Yeah, so I always was an athlete growing up. I loved playing sports, so I figured, I wanted to do something that was really active. I didn't want to have like a desk job. So I got into physical therapy thinking that I wanted to work with athletes. Then during my schooling, I realized I didn't like working with athletes. I kind of pivoted and took internships in different roles. And I started working with the neuro population, and I fell in love working with people that had strokes and brain injury and those sorts of things. And then over my 13 years as a PT, I've obviously expanded. I've worked with every population that you could think of. And so now I'm here at Trinity doing mostly outpatient orthopedics. We still get a lot of neuro, vestibular, dizziness. But I love that every person is just different, it keeps you on your toes. Not everybody with a knee or a shoulder is exactly the same. So that's what I really like about being a physical therapist now.
And I think that's the best part about PT is that there's just so many different settings that you can work in. So if you wanted to do something really specialized, you can. But the beauty of outpatient is, like you said, you do kind of get a little bit of everything. So it's kind of always fresh and new and different.
Exactly, yeah.
Awesome. So what do you enjoy most about working for Trinity?
So that's really the same thing. I want people to feel better. So, at the end of the day, my goal is to help people feel better. On day one, when they come in, I'm like, what are your goals? What brought you here? What do you want to get back to? Do you want to be able to play with your grandkids again? Do you want to be able to go on vacation and go hiking? So I think really just getting to know the patients, trying to figure out what I can do to help them feel better is really my ultimate goal. And sometimes we have to change things, giving home exercise programs, just making them accountable. But yeah, I always just really want people to feel better.
Yeah, no, absolutely. What are some common misconceptions about physical therapy?
So a big one is that you need a prescription to get started. You do not need a prescription to get started for physical therapy. You can actually walk right into the clinic. If there's same day appointments available, we can take you in right away. We do require a prescription within 30 days, but you call your doctor a lot of the time, you're in pain. They can't get you in for 2 weeks. Call us instead. We can get you in the same day, if not, definitely by the next day. So that's really one of the biggest things that I would say. Another thing is you don't need an MRI, you don't need x-rays, you don't need any sort of imaging. Again, you're gonna come in here, your physical therapist is gonna do a comprehensive evaluation. We're gonna look at everything and kind of give a diagnosis. We're gonna work on for about 4 to 6 weeks. If then you're not feeling better, then maybe we would recommend getting some imaging for just some further information, but it's definitely not required. The other thing that I would say is you don't need to have pain to come here. Everybody thinks I need to have a problem or be in pain. If you have balance issues or you're dizzy or even, you're afraid that you're, starting to get more unsteady or you're not as active as you want to be, you can come in here and we can, get you stronger. We can get you more flexible so that we prevent injuries from happening in the future.
I definitely think that that's one of the biggest things that I'm really glad that you brought up is because I do think that people assume that physical therapy is only for I've injured myself or I've had a surgery. So people understanding that physical therapy is prevention as well, I think is really, really important.
Exactly.
Can you explain the difference between physical therapy and other forms of rehabilitation, like chiropractic, for example?
So again, there's always that discussion about which is, better. And for some people, you have to make your own decision. But physical therapy is very comprehensive. We are trained in the muscles, the bones, the ligaments, the joints. We look at gait, we look at balance, we look at vision, we look at coordination, we look at everything. So we're gonna take you as an overall picture.
Yes.
During your sessions, you're gonna do some exercise, you're gonna do stretching, you're gonna do a bunch of things, but we also do the hands-on techniques that you would get at a chiropractor as well. We do soft tissue massage, we do joint mobilizations, we do some muscle, bone and joint alignment, muscle strength and energy techniques. So we do everything. We are really comprehensive. And then we also give you home exercise programs. So a lot of the time we're not just fixing the current problem, but we're again, like preventing it from happening and recurring again. So we're giving you the tools that you can take for long lasting results.
Now, hot ticket question. What would you say to people who assume that physical therapy is very much like having a personal trainer or going to personal training?
So we're gonna do exercises like you might see with a personal trainer, but we are also doing the hands-on mobilization techniques. We also are doctorate certified, so we have been in school. We do all have our doctorates and pass a board certified exam. So we are looking at it from more than just the exercise prescription area. We are doing it as a whole overall picture. The techniques that we learn in school are not something that a personal trainer can perform on a person.
Great, awesome. What are some key benefits of physical therapy that people might not be aware of?
So again, it's really a conservative, non-surgical intervention. So, you may have somebody that comes in that says, I'm definitely gonna have to have a knee replacement. Well, a lot of the time the surgeons will recommend that you come to us before the surgery because you're gonna get stronger, you're gonna learn exercises, it's gonna put you at a better, position for after the surgery so that you do get better faster. I would also say a lot of people don't know that we do treat vestibular and balance disorders and dizziness. So if you are experiencing dizziness, a lot of the times doctors may just prescribe a medication to mask the symptoms, but they're not actually making you feel better.
Right.
You can come to us, we will do again an exam, figure out where the cause of your dizziness is coming from, and we can treat that. Same thing for people who've had falls. So there's a lot of things that we work with that you may have, not be aware that physical therapy can actually help you with.
Awesome.
We also do talk about like activity, lifestyle modifications.
Right.
A lot of people are working from home nowadays, so your workstation may be contributing to some neck pain or back pain. We can talk to you about some ergonomics, give you some techniques of things, maybe the way you're sleeping, stress management techniques. So we're not just doing physical therapy per se, we really encompass a lot of other, education that we can provide you as well.
Yes. What can patients expect during their first visit of physical therapy?
So during the first visit, you're going to come in, meet with your therapist. We're going to have your past medical history. We're going to ask about, age, cultural things like in your community, anything that may give us a picture of, where you're coming from before here. Then we're going to say, what is your problem? You're going to tell us, how long the problem's been going on. Is it new? Is it chronic? And then we'll be able to kind of do a full exam. Again, we're going to test your balance, coordination, strength, range of motion, everything that you could think of, your gait. We're going to look at how you're walking. We're going to talk about what you do for work. Are you sitting all the time? Are you standing all the time? When are you having pain? When are you not having pain? What makes you feel better? What makes you worse, etc. And then after that, we're going to get a picture of kind of what we think is going on. We'll do some treatment interventions, like I said earlier, with stretching or hands-on massage, mobilization techniques, and then we'll give you exercises to do in the clinic. And then also we will send you home with a home exercise program. We'll give you a prescription. Usually we recommend that patients come 2 to 3 times a week for anywhere from 4 to 8 weeks, depending upon your condition. And as you come, we're going to be deciding how you're doing. But that's really it on the first session. We always ask patients to just be open and honest. Tell us what your goals are and what your expectation is. What do you want to get back to doing so that I can come up with exercises and goals to help you, get back to what you want to do.
Amazing. How do you customize treatment plans for different patients?
Same thing that we just talked about. Again, I think the biggest thing is listening to the patient and really understanding what they want to do. Like I said earlier, do you want to get back to playing with your grandkids? Do you need to be able to sit at your desk for 8 hours a day? Do you want to be able to sleep without pain? What do you want to do? So once we know what your individual goals are, we can absolutely come up with special treatments for you. Not every shoulder patient is going to get the same exercises. Just because you might be 90 years old does not mean that we're going to dumb down your program. I mean, I have 90-year-olds doing deep squats and push-ups. So it really just depends on what your activity level is, what you want to do, and we'll go from there.
And I think that's something that goes into earlier when we talked about common misconceptions of physical therapies. I think a lot of people assume that a shoulder program is going to be the shoulder regardless of who the patient is or regardless of your age or your limitations. And here at Trinity, I know that one of the things that we really strive for is listening to the patient and coming up with a program that is specific to the goals and needs of that patient.
Exactly.
Awesome. Yeah. What advice do you have for someone considering physical therapy but feeling apprehensive about starting?
I would always say come in and at least talk to us. This happens all the time. People are very busy. They don't know if they can find time in their schedule. Maybe they've never even exercised before, or they just don't really know what physical therapy is. Come in, have a conversation. Tell me what's going on. Tell me why you're apprehensive. Maybe we can come up with a solution for you. you know, there's always something that we can do. And even if it's that you decide you don't want to do physical therapy, at least you can walk away with some education about what we do. Maybe I can give you some tips. Again, at the end of the day, my goal is I want you to get better. That's why I'm a physical therapist. You know I can help you, but if you're not ready to be helped by me yet, at least there's some sort of knowledge or something that maybe I can provide you that will help you, you know, now or maybe down the line in the future.
Yeah, and this is why it's so great, I think, that we offer those free consultations for patients to be able to come in who have questions. They're not 100% sure what they're looking for, but they get to sit down and speak with an actual therapist and go through that before committing to anything.
Exactly.
Yeah. What motivates you to continue learning and growing in your profession?
I think, again, you know, the profession's constantly changing.
Yes.
I've been a physical therapist for 13 years, and there's things that I learned way back when that, you know, maybe aren't as applicable now. There's constantly new research coming out, there's new technology. You know, Trinity has the EPAT machine, which we use a lot. It's, you know, an acoustic pressure wave therapy that helps promote blood flow, breaks up scar tissue. That's something that I didn't know about. And so, you know, I continue to be motivated to learning about those types of treatments that we have that we can offer to our patients.
Awesome. Well, Pam, thank you so much for sitting down with me today. I really appreciate you taking the time. To everybody who is listening, again, this was Behind the Session, Meet the Therapist. This is our Trinity Rehab mini shorts. Please feel free to call us directly at 1-800-518-0977, and you can book your free consultation today.